I think first of all is to say that to thank the CHS and the whole team because of the work that you're doing to the community, and my colleagues here because of volunteering themselves. But I always tell them that when you do good something to the people, you are doing actually to the God. You are brought to this world by God so that you can serve His people, and therefore we have to continue doing it that. And therefore, thank you for everybody who has done that through CHS. I would say clearly, like the transmission from HIV virus from the mother to the child in Laikipia, basically in Nyahururu, because that's where the CHS are supported. It has done very well because that trend, the figure has been going down, and as far as last year, but one, we had 196 mothers who are being followed up in the clinic, and all of them at the end of the test, we found that all the children had turned to be negative, all of them. So we had 0 who turned positive.
Wonderful, thank you.
Last year, through the same, we followed it once again in the same hospital, but unfortunately this time we had 1. And this one child, it was not actually from Laikipia. It's a mother who actually came when she had already delivered and came to be followed in Nyahururu Hospital. Therefore, I would say that this work which you are doing, I believe that we can actually go beyond 0, as the motto is right now through the First Lady. On the other hand, I would like to say that in terms of the people who actually, the employee, the people, so there's the employed through contract by CHS. Laikipia County, when I became the Minister of Health of Laikipia County, I went to all the facilities, visiting the hospitals, and one of the questions which was being asked by those people who are actually employed as contracts, through contracts, they were asking, are we going to be employed by the county government? And you as a minister, and they are looking at you, what did you tell them? You tell them yes, isn't it? Yes. Our governor says that every time when you meet people, give them hope, but don't discourage. And therefore, through that hope, I promised all of them that you're going to employ them. And I would say that in Laikipia County, all the workers who are under contract, all the workers who are under contract, we have absorbed all of them. And they are, what are the arrangements that you have made? The arrangements which you have made is that, for example, I talked to Dr. Kesa when you are absorbing them, and I told him that the best solution is that we absorb the ones who are under contract and the CHS to employ more. And therefore, we had that team in Nyahururu, we have employed all of them permanently, and they have recruited 10 through our chair of the service board who is there. Mary Motoni, can you start, please? She has done the work, very good work. And I believe that this one is sustainable. The reason is, look at our hospitals currently and our health workers. I one time went and asked all of them when we were having a meeting, those who are below 35 years to lift your hands. And actually, they were actually less than 10%. So you can imagine our workers are between 50 and 60 years old. And these people are retiring. So if you have people and they are leaving, what we have done in Laikipia County is that we are actually replacing the ones, because we have already budgeted for them for this year. If they actually leave, they are going to leave that money, it's not going to be utilized. So the best solution is, we pick them, and we pick, because we replace them with others, and therefore we are going even to advertise for this year. But for those ones we absorbed from the CHS, it was not replacement, it was actually to absorb them. But how it is sustainable is, I believe that every year in Laikipia County, so long as I'm in that government, we should actually be able to replace the workers who are leaving. If the national government was doing that one before, we would not be having the shortage that we have today. And if you look at it clearly, is that, for example, now, the ones who are retiring in Laikipia County this year, they are actually 42. And out of those 42, we are going to actually, because the salary now, we are going to absorb them at a lower salary. We are going to absorb almost 60. So we have an extra. of about 18 of them. And if with that one, then I believe that those ones we are going to absorb through the contract once again, I will be able to absorb them so long as there will be that government through that replacement. And therefore it is sustainable. And I believe the best thing which it is that we have to think for our people. We have to think and know that even these people, and actually I'm very sorry to mention this, the CHS workers, because their contract was the one which was ending last. I started with the ESP, then I went to the capacity, and the CHS people, they came and they told me that if you have absorbed the others, if the county government have absorbed the others, why are you letting us down? And somebody had passed the message to them that they are not going to be absorbed, which was not true. So when it came to that time, I requested the chairlady of county's service board, and she actually did the interview. The only thing which I'm going to request, if you follow what the Laikipia has done, and this the chairlady can actually support me in that when you are doing the recruitment of the contract, can we actually interview the people who have qualified for those jobs? Because we had problems when we were absorbing them, because somebody is a secretary by training, but not through the CHS, but now the other contractor, and this person is employed as a councillor. So this person, we had a problem because are we going to absorb as a councillor and it is as a secretary? So what we did is that such that we don't frustrate them, we actually absorbed them as secretaries. But you see now we didn't need a secretary, isn't it? So that's what I would request that what we're doing, and I think our challenge that is what she's doing, and I said, can we come for her please? He is actually advising us that let us absorb somebody who we can be able to absorb in the future. I believe that we can sustain it if we can work together. And these people, if we don't do this, they are getting demoralized. Right now, I have so many who are requesting to come, and we absorb them from Garissa, from Madeira. They're saying, can we come to your county? But these people, if they stay like that, they still feel demoralized. And you know, when you're working with somebody who is demoralized, it is not good. And therefore, I think that is what you have for Laikipia.